Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Tom here with us today. And Tom is a veteran of the Navy. 8 years you served, right?
Correct.
Thank you very much for your service. He's a veteran in the VA system here, and we treat a lot of veterans here at this office. Now, I wanted to talk to you about something that you guys have mentioned in comments and posts before on our YouTube videos, and that is, how do I make determinations of what treatments to provide patients, and also what do I look for risk of stroke, and how do I do diagnostic tests to rule out atherosclerosis and plaquing of the arteries, carotid arteries, and vertebral arteries, so that cervical chiropractic adjustments / manipulations don't precipitate a stroke in a patient. Well, first of all, I do that by taking a history of our patients, asking them about their previous medical history and lab work, diagnostic testing that they've had done. Tom has high triglycerides in his blood test. He also has had some dizziness and kind of lightheadedness in the past. So that alerted me that he is a risk for stroke. So what I have done is I have written an order for him to get a ultrasound and Doppler studies on his carotid and vertebral arteries in his cervical spine to rule out any atherosclerosis or risk of him having a stroke due to cervical adjustment / manipulation. And I haven't been adjusting his neck in a way that would cause cervical manipulation, dissection of the carotid or vertebral arteries. There are safe ways to adjust the cervical spine without creating that type of trauma, and I'll show that to you today, because we're still not doing anything on him that would put him at risk for having a stroke. And we've been seeing you now, this is your 6th visit, right?
Yeah. You
haven't had any stroke on us yet, have you?
Nope.
Nope. Not going to either, are you?
Not planning on it.
Not planning on it, no. Well, but anyway, his VA doctor agreed with my assessment on that and is going to go ahead and do those at the VA for you, right?
Right.
Houston has a great VA system, by the way, much better than most of the systems in the country, and we want to thank them for their great service to our veterans, because you guys deserve the very best of what healthcare has to offer, and we appreciate your service and your sacrifice. All right, so let's show them how we treat you here. They're probably getting bored of hearing that. Okay, let's flex you forward and backwards. But we respect our veterans here very much in the state of Texas. Yeah, now see, you can see he's a little weavy. Mary Lou's been using him as a bobblehead on their dash. No, I'm just kidding. She's using you as something though, isn't she? But right in here. Or do you drive? You drive. So you're the side seat driver, huh?
I side seat.
Mm-hmm. Okay. So we've evaluated his posture 3-dimensionally, and I'm going to lie him down on his stomach with his face here up in the headpiece here. Now, of course, we do not do the manual spinal decompression ring dinger on him because of his risk of having atherosclerosis in his carotid and vertebral arteries. But we do and are able to help him by adjusting the rest of his spine, and including his cervical spine specifically, certain ways that aren't dangerous. So, gosh, how many patients have I referred out for ultrasounds and Dopplers this week alone? Probably 10.
Yeah, this week. Yeah.
Alone. And people, if you're coming in from out of town, please bring your x-rays, diagnostic tests, blood work, any doctor's reports that you have, because it's very important for me to see your past history. Good.
if not, you'll send them out and
Yeah, if
Got
not,
Got
just
to
like
come
these
back.
patients that came in this week, I will not treat you until I am 100% confident that the treatments that I'm going to provide to you are going to be safe and effective. And we minimize risk of people having strokes by doing the appropriate histories, examinations, and referrals for diagnostic testing to rule out atherosclerosis of the vertebral and carotid arteries, which is plaquing in the carotid arteries and vertebral arteries, and those are in fact risk factors for a person having a stroke. Now you notice I'm not putting a great deal of pressure on him in here either, because he's got a little bit of osteoporosis going on, so we adjust him very lightly. Now see, I'm adjusting his cervical spine strictly in the lines of the facet joints themselves, very lightly, but it still moves the facet joints enough to take some of the pitching off the nerve without insulting the carotid or vertebral arteries. Okay, let's turn you on your back now. And you know, you could just as easily have a stroke sitting in the dentist chair or at the medical doctor's office or driving down the street for that matter. Okay. We're going to put your arms out to the sides for me now, please. Slide down just a little bit this way for me. There you go. Must have extra pancakes. There you go. There we go. Good. Okay. Now just relax your leg right here in my hand. There we go. Should have felt that all the way from your knee up to your lower back. There we go. Good. Okay, let's sit you up, face this way towards Joseph. There we go. No, this way. There we go. Okay, just relax this arm. Breathe. There we go. Good movement there. There we go. Good. Good. Yep. Good. Okay, let's stand you up here in front of the mirror and I'm going to show them how to adjust your cervical spine safely with this instrument. Now, this is about the 50 millionth time I've gone over this with y'all of what this instrument does. It's a high velocity, low amplitude adjusting instrument that just percusses the atlas transverse on the outside on the x-axis. Pull your shoulders up and back for me, Tom. I'm going to bring your head straight back this way. No, don't tilt it backwards, just like that. You're going to feel a little tap right there. Another little tap right there. Okay? Now, I want you to bend your head forward and backwards again. And watch how much steadier he is this time. He's not weaving near as bad this time, and that's a lot better range of motion too, isn't it, Tom?
Mm-hmm.
Take a look at that posture in the mirror right now. Standing up straight like you're supposed to. Good. Like they taught you in the Navy, right?
That's correct.
Stand up straight. So what would you share with our YouTube subscribers about you and your wife's experience here at Advanced Chiropractic Relief?
Walked in with a headache, hips hurt, my ankles, and I have no pain now.
Praise the Lord. Merry Christmas. That's a good
Merry
Christmas
Christmas,
present, isn't it?
I'm telling you.
Yeah. And you and your wife come in here just on an as-needed basis. We don't put you on a big schedule or anything, do we?
No,
So you just call us to come in when you need to, right?
that's correct.
So this is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, and we are protecting your health and improving your health and wellness here at Advanced Chiropractic Relief. So go to advancedhoustonchiropractor.com and fill out an appointment request. Fulfill your bucket list for 2017. We'll see y'all then.